In today's health headlines, new guidelines for COVID isolation. Norovirus cases continue to surge in the Northeast. And what to know about the mystery virus trending on social media. Here's Ken Houston.
Thanks a lot, Ann. Now joining us right now is Dr. Scott Roberts, Yale Medicine Infectious Disease Specialist and Assistant Professor at Yale School of Medicine. Welcome back and thanks for joining us.
Thank you, Ken.
Well, as you know, the CDC has announced the new guidelines for COVID-19, including suggestions for testing, prevention, and masking. What else can you tell us about this?
New CDC guidelines really change how we handle COVID to match that of other respiratory viruses such as flu and RSV. So it's going to sync up and essentially say that stay home when you're acutely sick, but you can resume normal activity once the fever's gone for 24 hours and symptoms are improving. I do want to emphasize that the same strategies still work for COVID. We know vaccination works to prevent severe disease. We know washing hands, avoiding people who are sick, good ventilation, and masking in high-risk settings can still be effective for COVID as well as other respiratory viruses.
Definitely good advice that has saved a lot of lives. Let's talk about norovirus right now. Cases here in the Northeast continue to surge with a positivity rate of over 16.5%. How can we stay healthy during this uptick?
That's a great question. First, norovirus increases every winter, so I'm not too surprised by these numbers. And certainly locally in New Haven, cases are high, but they're below that of last year. Norovirus spreads through contaminated surfaces, such as hands and foods, which are then inadvertently put in the mouth. So it's important to wash hands with soap and water. This is better than Purell or those gels, since norovirus can survive some of those. It's important to disinfect and clean surfaces with a product that has a norovirus claim. And I always recommend microwaving food until it's sizzling, just to be extra sure. I also recommend avoiding people who are acutely sick with gastrointestinal symptoms. And if that's a family member, to separate areas in the house, such as using separate bathrooms.
All right, now this is a scary thought. Mystery virus is trending on social media, I understand, but symptoms are similar to many common viruses. What do you know about this?
What I know is that the reported symptoms are pretty nonspecific and flu-like, and that these are people who test negative for COVID. So all of this really suggests this is probably just common winter respiratory viruses such as the flu, RSV, rhinovirus. We have many of these. And right now, we're still in the winter season, so many of these viruses we know are still circulating. So I'm really not concerned about a new virus. I would trust information from public health officials such as state health departments and CDC before jumping to conclusions. But I doubt this is a mystery virus, and I'm guessing this is just our usual seasonal pattern of winter respiratory viruses.
All right. Sounds like you're not too worried about it, which is definitely good news to me. Thanks a lot.
Definitely not.
Dr. Scott Roberts, thanks for joining us, and have a great weekend.
You too.